Hello everyone. Okay, welcome back. Today we're going to discuss about the wound healing. Okay, so this is also one of the very important topic in general surgery. Multiple questions has been asked in your FMG exams. So let's see the wound healing over here. First of all, we have one question. A 14-month-old child presents with erythematous, scaly, and pustular lesion. So remember here, erythematous, scaly and pustular lesion, right? And this is around the perioral region, that means around the mouth, right? So these are the features of what? Dermatitis, right? And patients also has the diarrhea. This is the feature of what? Enteropathy. Enteropathy means inflammation of the intestine. So which of the following also the patient has the problem with the wound healing, that means the poor wound healing is over there. So number one, number two, number three features has been present in this child, and this is a child, remember, it's a 14-month-old child, right? So what is the deficiency in this child? So look at here, copper deficiency. If the patient has copper deficiency, what happens? Selenium deficiency, zinc deficiency, or iron deficiency, right? If the patient has the copper deficiency, then there should be what? The anemia should present over there. Anemia plus neuro degeneration should present over there. So there is no features of anemia, no features of neurodegeneration, so it cannot be the copper. If there is selenium deficiency, then the patient should have the cardiomyopathy, cardiomyopathy, right? Plus patient should have deficiency in T3 or T4. No features has been given over there over these features. Similarly, iodine, if there is iodine deficiency, it is directly related to what? The thyroid gland, so there must be the thyroid dysfunction, right? So this no features has been given over here. So what is the features given in this question? The features has been given over here as the dermatitis plus the features of enteropathy plus the wound healing delayed, right? So these features are consistent in a child aged with acrodermatitis enteropathica. Is that okay? Acro means limbs, so that there will be the dermatitis within the limbs, and then there will be the wound healing problems, right? And then the enteropathy. This is which in the question is shown about the diarrhea. Is that okay? So hope you understand. So this is the condition of what? The zinc deficiency. This is a inherited disorder, congenitally autosomal recessive. What is this one? Autosomal recessive inherited disorder. Is that clear? In which there will be the congenital zinc deficiency. Let's go forward with some of the terminologies over here. What is wound? The wound is, we know already, that is break in integrity. If somebody is new, that we know already, those students who are continuously following our lecture, they know these definitions already. Breaking in the integrity of the tissue or the skin, that produces the wound, and this may produces the functional slash structural abnormalities, right? Ulcer means what? This is a small breach. It's a smaller form of the wound, a small breach in the epithelium, or maybe mucosa, or maybe organ capsule, right? It does not produce the functional or structural abnormality is intact. Is that okay? So this is our ulcer. And what is surgery? Surgery means either we use the scalpel means the knife, and either this one the diathermy, right? So diathermy, and then we gain the access, access to the deeper tissue. Is that okay? So this is called what? The surgery. Once we get the access to the deeper tissues by surgery, we do the procedure. We do the procedure. After doing the procedure, we go for the wound closure. So after the closure, whatever the wound remain over there, right, after the sutures, whatever the wound remain over there, this is called what? The surgical wound. And this surgical wound get the infection, right? This is called surgical site infection of surgical wound. What is this one? Infection of surgical wound. So this is one of the most common healthcare associated healthcare associated infection in surgical patient. Is that okay? About 6 to 16% of the surgical patient gets the surgical site infection. So this is one of the most common healthcare associated infection. Another point, this infection usually gets developed in 3 to 5 days. This 3 to 5 days it develops the cellulitis around the wound, right? So in around 7 to 10 days it develops what? The suppuration. Suppuration means the pus formation. Is that clear? So these are the questions in the exam. Is that clear? This is question. So please remember this one for the exam. Let's learn some of the terminologies. What is the wound healing? Wound healing means restoration of normal function and structure after injury. Is that clear? After injury, this is called the wound healing, and it has some stages. So this restoration of the function and structure takes place in the staged manner. So what are those stages over here? The stages are, once we will have the injury in the tissue, right? There will be the tissue injury. If we have the injury, there will be the bleeding. Yes, after the bleeding there must be the hemostasis, right? After the hemostasis there should be the inflammation. After inflammation there must be the proliferation. The healing process begins. Proliferation. After the proliferation it undergoes the remodeling at last, right? Remodeling means this some during the proliferation sometimes there gets the bigger scar, so that should be contracted and should be resized again to the normal structures, right? So this is remodeling. So these stages they takes place, and sometimes the question may ask during the proliferation. We'll discuss this in details later, right? So during the proliferation, what happens over here? There are multiple factors they plays the role. Like you have the growth factors, there is the extracellular matrix, right? Similarly you will have the integrins, right? So all of these factors will cause the proliferation of the tissues. Is that clear? So these factors, they are coming from either the macrophages, right? Either they are coming from the macrophages, or they may be coming from the epithelium, right? Or they may be coming from the stem cells. Do you know the stem cells, the source of the stem cells? Right? So the source of the stem cells are either the bone marrow or maybe the capillaries, right? So from these sources they causes the proliferation. So you understand, right? Now after that, let's see over here the wound repair. What is this wound repair means? Wound repair is equal to wound healing. It is the same thing, right? But the wound repair is a terminology we use for the surface epithelium. And wound healing is the terminology we use for the parenchymal tissues, and then the connective tissues, right? So and then the connective tissues. Hope you understand. So this is wound repair is equal to wound healing. After this, let's see over here what is acute wound and what is the chronic wound. If the wound heals within less than 12 weeks or 3 months, this is called the acute wound. If the wound heals in more than 12 weeks or more than 3 months, then we say this is what? The chronic wound. So this is the question in the exam. Please remember. Let's go over here. The steps. The wound repair or wound healing has the 2 stages. Look at here. One is the regeneration. Another one is the scar formation. Is that okay? What are those? The regeneration and then the scar formation. Let's make one picture over here and then understand by that picture. Is that okay? So in this picture, I'll make one wound over here. So let's see, this is my wound, right? So once I have the wound, around the wound, I have the normal tissues as well, right? Around the wound, I have the normal tissues, yes? And within these tissues, I do have some stem cells. What do I have? Some stem cells as well. Is that okay? And I do also have some, the fibroblast. What do I have? Some fibroblast. Is that okay? So that during the wound healing, the 2 processes takes place over here. one regeneration occur, another one the scar formation occur, right? So that look at here, we have these tissues, these are our what, the residual tissues, residual tissues. Similarly, we do have here the stem cells, these are the tissue stem cells, plus we do have the stem cells within the capillaries as well, within the capillaries, plus we do have the stem cells within the, this is my bone, I don't know how does it looks like, so this is my bone marrow, right? So I do have the stem cells within the bone marrow, within the capillaries, right? So that these two sources, either the residual tissues will proliferate, or my the stem cells, either tissue stem cells or the bone marrow stem cells or the capillary stem cells, they grow, and then they try to restore the normal function and structure within this injured area, right? This way. So this is called what? Regeneration. So regeneration takes place either by the residual tissues or by the tissue stem cells, and this regeneration restore the normal function and then the normal structure. Is that okay? But at the same time, we do have the fibroblast. These fibroblasts, they begin to grow at this site, right? So as this grow to this side, at this point around this region where there is the absolute tissue injury occurs, right? So the site where we have the absolute tissue injured, in this places there will be the growth of what? Fibroblast. So this fibroblast, they begin to secrete the collagen, right? So this collagen, it forms the structure, but the function is decreased. Is that okay? So that during the tissue or healing or the wound repair, right? So or the wound healing, we have the two stages or two steps, the going on over there. Two pathways are going on over there clearly. That is one regenerative pathway, another one is what? The scar formation pathway. So scar formation is carried out by the fibroblast, and then the regeneration is carried out by either the residual tissues or the tissue stem cells. Is that clear? So if there is the regeneration, at the site of regeneration, then what happens? We have the normal function and normal structure, and at the site of the scar formation, there will be the the structure is formed, but the function will be decreased. And one more point I want you to understand over here, right? In all kind of wound, both the steps goes on, but for example, you can take, if it is the surgical wound, this surgical wound have the more regeneration, less scar formation. Is that okay? So that the function will be intact. But rest of others, if there is the dirty or infected wounds, right, unclean wound, they will have more scar formation, and we have the more scar formation and then the less regeneration, so that they will have the less function. Is that okay? Functionally they will be less potent. Hope you understand, right? And then let's go forward with another point over here. So what is the fibrosis? Here we discuss about the scarring, right? So scar formation and fibrosis, they are two similar terminologies. Fibrosis is the earlier terminology to the scar formation. First point. Is that okay? Another point, fibrosis is the terminology we use for the internal organs like kidney or the lungs or the liver, or sometimes in the heart after myocardial infarction, right? So this is, we use the terminology fibrosis. What happens in this condition? There will be the inflammation more than injury. Is that okay? By that inflammation, there will be the exudative fluid in between the tissues. So we will have the exudative fluid in between the tissues. These exudative fluid are rich in fibronectin, right? So this once this exudative fluid, the serum gets reabsorbed, the fibronectin get clumped. Is that okay? So this is called finally what? Fibrosis. So that Fibrosis occurs within the tissue space where we do have the inflammatory fluid. Where does it occurs? Where do we have the inflammatory fluids? And when these fibronectin later on replaced by the collagen by the fibroblast, then we call this is as what? The scar formation. So if you understand, right? So scar formation and then the fibrosis are two similar but different terminologies we use. Now let's go to the source of tissue repairs. So what are the sources of the tissue repairs? Look at here though. In the source of tissue repairs, I'll draw one picture over here. Is that okay? So you understood already the source of tissue repairs. This is my wound, and around the wound I do have uninjured tissues, right? Uninjured tissues, and in between the uninjured tissues I do have the stem cells. We see it already, right? And stem cells, they are also present within the bone marrow. Let me draw a nice picture this time here. And we also have the stem cells present within the capillaries, right? So we will have these stem cells over here in the capillaries as well. And we do have the fibroblast over here. Let's make the fibroblast with different color. This is my fibroblast, right? So yeah, so these much things we do have. So once we have the injury, so this is the site of what? Injury. Once we do have the injuries, these are the residual cells. Residual cells, they begin to proliferate. Is that okay? At the same time, we do have the stem cells here and there, right? So these stem cells, they begin to proliferate. Stem cells, they begin to proliferate. At the same time, we do have the fibroblast. This fibroblast, they begin to secrete the collagen. So this is number 1, this is number 2, and here we have number 3 source. At the same time, we have the vascular endothelial cells. These vascular endothelial cells, they begin to grow and they form the multiple vessels as the angiogenesis. Is that okay? So these are the vascular endothelial cells growth. So this is the 4th source. So what are the sources of the tissue regeneration or tissue repairs? Number 1, residual cells from the tissues. Another one, the stem cells. The stem cells may be within the tissue, maybe in the bone marrow, or maybe in the capillaries, right? At the same time, the fourth source can be what? Third source can be the fibroblast, and then the 4th source can be what? The capillary endothelial cells. They themselves grow for the angiogenesis and they forms the new blood vessels at the site of the injury, so that the blood flow restores and then the tissue regeneration or repair occurs faster. Is that okay? Hope you understand. And the another point you have to understand is that this the tissue regeneration or repairs, it begins within 24 hours of injury. This is a question in the exam. Is that okay? So in how many hours it begins, right? So it begins by the 24 hours of injury, and once it begins to begins to regenerate, once the tissue begins to regenerate, right? So it begins to forms the blood vessels, new blood vessels. The fibroblast begins to grow, right? The epithelial cells, they begins to grow. At the same time, we will have the chronic inflammatory cells, right? Acute inflammatory cells and the chronic inflammatory cells. So they will finally form what? The granulation tissue. Granulation tissue is the sign for tissue regeneration. This is also the question in the exam. Hope you understand. Now let's go to the phases of wound healing. So what are the phases of wound healing? We have different phases of wound healing. Look at here, WIPER, wiper. So please remember this, the wound healing as the wiper. Hope you know what is wiper, right? Wiper is this one we used to clean the floor. Yes, remember this as wiper, the tool of wiper, which is wiping your wound and making your skin normal, right? So your tissue normal. So this is your wiper. So wiper means what? W for wound, I for inflammatory phase, P for proliferative phase, R for remodeling phase. Is that okay? And remember over here, inflammatory phase usually go for up to 3 days. How many days? 1 to 3 days is your inflammatory phase. And proliferative phase you will have from 3 days to 3 weeks, right? And then remodeling phase starts from 3 weeks to 2 years. Is that okay? You have to understand these are the questions in the exam. And in the inflammatory phase, you will have the what is this one, the acute inflammatory phase, and then the chronic inflammatory phase, right? So in the acute inflammatory phase, what happens, you will have the neutrophil predominant. This is a question in the exam. So neutrophil, they begins to recruit from 4 hours and becomes maximum at 48 hours. Question in the exam, right? And in the chronic inflammatory phase, the macrophages will be the predominant cells, right? So these macrophages, they becomes predominant in the chronic phase. They begins to recruit from the 48 hours and they become maximum at 72 hours. Maximum macrophages, maximum neutrophils at 48 hours. So this is also the question. This is also the question in the exam, right? And in the proliferative phase, we'll discuss later. Remodeling phase, we'll discuss. Let's go forward with the yes. So you can see over here this chart. Yes, we have seen over here, as you have the injury, immediately after injury they will have the coagulation or vasoconstriction. After that there will be vasodilations, right? So look at here, up to 3 up to 5 minutes or 5 to 10 minutes you will have the vasoconstriction, so that the bleeding stops. After 5 to 10 minutes you will have the vasodilation. After you can say 5 to 10 minutes you will have the vasodilation, so that the normal the restoration of the blood flow occurs, so that tissue regeneration will be faster. And look at here, the inflammatory phase begins. Inflammatory phase begins by the 4 hours, by the 4 hours of injury, right? No, it begins immediately after the injury, but it takes 4 hours for the neutrophils to be there at the site of inflammation. So that's what we have to say. And then neutrophils, it begins to come by 4 hours and become maximum at 48 hours, we said, right? And then the macrophages, they begins to come after 48 hours and they become maximum at 72 hours. So if you understand, right? And then the other the processes they are going on. So this is the inflammatory phase. So what happens in the inflammatory phase? Let's see one picture over here, right? So if we have the tissue injury, once we have the tissue injury, we'll have the bleedings, right? We'll have the bleedings. Once we have the bleeding, there will be the vasoconstriction. There will be the vasoconstriction. This vasoconstriction is mediated by TXA2 and endothelin. These two things, they causes the vasoconstriction. After the vasoconstriction, there will be the platelets, the platelets aggregation over here. After the platelet aggregation, there will be the activation of the clotting factors. This is my platelets and then the clotting factors. So finally what happens, the bleeding stops, so they will produce the hemostasis. Is that okay? So for this hemostasis, it takes maybe already the clotting time, right? So up to the 5 to 10 minutes, yes or no, right? So they will have these stages. After this, what happens, there will be the recruitment of your neutrophils. They begin to come, right? Neutrophil, they begins to come. And when the neutrophil begins to come, at 4 hours and goes up to how many hours? 48 hours maximum, right? And at the same time you will have the macrophages, they begin to come, right? So these macrophages, they begin to come from 48 hours and become maximum at 72 hours. Hope you understand, right? So that these macrophages and then the neutrophils, they begin to phagocytose these organisms, right? And then at the same time they begin to release the inflammatory mediators as well. At the same time you will have the mast cell activation over here. That mast cell, it begins to release the histamine. This histamine begins to cause the vasodilation. Vasodilation occurs after 10 minutes. Is that okay? So that what happens, these stages where we have the blood clotting and all, these stages is called what? The vascular phases or stages of the inflammation. And here we have, these are our what? Cellular phases, right? So this vascular and cellular phases, they makes finally the inflammatory phase. And by this all, what happens, there will be the tissue edema. Hope you understand, right? So, and at the same time tissue edema, there will be the swelling, there will be the swelling. Hope you understand. Is that clear? So this phase is also called the exudative phase, because here is the tissue exudate, the edema fluid will be there. So exudative phase, or it is also called the lag phase, or it is also called the substrate phase. Is that okay? So it goes for how many days? It goes for 1 to 3 days. And here is the mnemonic, you can remember as IVC, because there is the vessel involved, so we use as the IVC, intravascular catheter, as a mnemonic. So I for inflammatory phase, B for vessels, vascular phase, C for cellular phase. Hope you understand this, the inflammatory phase, right? And you can see this picture in the inflammatory phase: vasoconstriction for 5 to 10 minutes, vasodilation after 5 to 10 minutes. These are the questions in the exam, right? So please remember this one. After this, we go to the proliferative phase. Yes, in the proliferative phase, we have the ACE, the fibroblast, right? Because proliferative phase, here the inflammatory phase was carried out by what? The blood vessels, and then we have the macrophages, and then we have the neutrophils. These are the predominant cells in the inflammatory phases. And let's go to the proliferative phase. What are the the predominant cells in the proliferative phase? This is what the fibroblast is, the predominant cells. At the same times, the epithelial cell are the predominant cells. That's why we use the mnemonic as ACE, the fibroblast, means stimulate the fibroblast, right? So what are those ACE for? A for you have angiogenesis, C for you have the contraction, the wound contraction, E for epithelialization, and you have the fibroblast as the fibroplasia, right? So these are the different 4 stages that occurs during the proliferative phase of the wound healings, right? And the proliferative phase goes for how many days? You understand already? That goes for 3 days to 3 weeks, right? So at first, let's go to the angiogenesis. So during the angiogenesis, what happens? You have the blood vessel injury like this, right? Because tissue injury means there was the blood vessel injury, yes or no? So when you have the blood vessel injury, you have the tissue over here. This tissue develops the hypoxia, right? Once the tissue develops the hypoxia, they release the HIF, hypoxia-induced factor. What are those hypoxia-induced factor? These hypoxia-induced factor are TNF and interleukin 2. TNF alpha and interleukin 2. This is the question in the exam, right? Hypoxia-induced factor. These hypoxia-induced factor, they will go and stimulate the vascular endothelial cells. Vascular endothelial cells begin to release the VEGF, vascular endothelial growth factors. These vascular endothelial growth factors, they begin to activate the angiogenin 1 and angiogenin 2. This angiogenin 1 and angiogenin 2, they will go and further stimulate the vascular endothelial cells. These vascular endothelial cells, now they begin to form the new blood vessels, new blood vessels, right? So this is called what? The angiogenesis. Is that clear? So this angiogenesis, it begins at 3rd day. Which day? Begins at 3rd day and becomes maximum at 5th day. This is the question in the exam. Is that okay? So this is about the angiogenesis. After that, let's go to the epithelialization. So for the epithelialization, let me clean this one. For the epithelialization, we have the 2 sources. One, we have the stem cells, right? We have the stem cells coming from over here. At the same time, we do have the keratinocytes, right? Keratinocytes. So either they begin to proliferate. Either keratinocytes, means the residual cells, or maybe the stem cells, right? Tissue stem cells or the bone marrow stem cells, they begin to proliferate. So this is my bone, hope you understand, right? So they begin to proliferate, and once they begin to proliferate, they form the thin lining over the wound, right? So it happens after 48 hours. That means the epithelialization also begins from 3rd day, right? After 48 hours means the beginning of the 3rd day. And then this epithelialization, it becomes a thin lining at 48 hours, and it becomes a thick line by fifth day. By fifth day, right? Thick lining means this is this. Okay, so this is about the epithelialization. After that, let's go to the fibroplasia. Fibroplasia means at the same time we will have the the growth of the fibroblasts. So growth of the fibroblast. This fibroblast, they begin to secrete the collagen type 3, right? This collagen type 3, they begins to increase the wound tensile strength. This tensile strength increases to 10% by first week. This is a question in the exam. Is that okay? So it is because of what? The collagen type 3, because the maximum tensile strength is given by the type 1 collagen. So here at the beginning of the wound healing, there will be type 3 collagen synthesis. They will ask you in the exam during the proliferative phase which type of collagen the predominates. That is what? Collagen type 3. This collagen type 3 synthesis, this also begins by the third day, right? So it begins by the third day and then it becomes maximum. It begins by the third day and it becomes maximum by the third week. See, everywhere we have the rule of 3, right? So the maximum collagen type 3 synthesis occurs at third week. Please remember, this is a question, right? Begins from third day and it becomes maximum at the third week. So it gives the tensile strength. Another point over here you have to understand, for the synthesis of the collagen, we need some specific factors over here. That is what? We need the copper, we need the iron, right? Similarly, we need over here the vitamin C, very importantly. Similarly, we need the alpha ketoglutarate. Is that okay? So all of these, they helps in the collagen synthesis during this phase. So if these the nutrients are deficient, then the wound healing will be delayed. So they can ask you in the exam, so during the proliferative phase, what are the nutrients we need for the wound healing? That means we need the copper, iron, vitamin C and alpha ketoglutarate. Among this, how does the vitamin C help? So let's see over here. During the vitamin C, the vitamin C will help in, for example, this is my the fibroblast. Fibroblast first secrete the tropocollagen. Is that okay? This tropocollagen has the lysine and proline. Is that okay? So once there is a presence of vitamin C, this lysine becomes hydroxylysine and proline becomes hydroxyproline. So once it becomes hydroxylysine and hydroxyproline, now this tropocollagen, it becomes the collagen, the mature collagen. Is that okay? So the vitamin C is required for the conversion of the lysine and proline to hydroxylysine and hydroxyproline. Is that okay? So that at the time of this fibroplasia or the proliferative phase, when you check the urine, in the urine there will be the hydroxyproline level increase in the urine. So the presence of hydroxyproline in the urine, this is the indicator of what? The rapid collagen synthesis. This is the another question in the exam. Is that okay? Hope you understand. After that, there comes the wound contraction. Wound contraction means because of the collagen, because of the fibroblast and because of the myofibroblast. Because of what? Myofibroblast. These three factors, they causes the wound size decrease. Wound size what? Decrease. So this decreasing of the wound size is called what? Wound contraction. So what are the factors causing the wound contraction? Collagen. You will have the, what is this one? The fibroblast. You will have the myofibroblast, right? So this wound contraction, about 50% of the wound size decrease by fourth week. By how many week? Fourth week. This is also another question. Hope you understand about the wound contraction, right? So yes, this wound contraction also begins at 5 days. So maximum wound contraction occurs at 5 to 15 days. This is another question in the exam. Maximum wound contraction occurs at 5 to 15 days. 50% of the wound size decrease by fourth week. And look at here, this is the picture of the wound healing, right? So you can see over here, at first you have the hemostasis of the inflammation, after the proliferation, and we're going to the remodeling now, right? So in the proliferation, you can see the thin epithelial lining forms. After that, this epithelial lining will becomes the thicker, right? So after that, yes, you can see over here Yeah, okay, some point I have to explain over here, right? So what is granulation tissues during the wound proliferation? We have to say granulation tissue means during the wound healing, we will have some factors like the fibroblast we will have, right? Plus we will have the blood vessels, right? Newly formed blood vessels. Plus we will have what? The chronic inflammatory cells. So combinedly these three things, they are called the granulation tissue. What are those granulation tissues? You will have the fibroblast, you have newly formed blood vessels, you will have the chronic inflammatory cells. These three factors, they are called what? The granulation tissue. Remember, this is a question in the exam. If this granulation tissue is excess, sometimes this is called what? The proud flesh. Proud flesh. Proud flesh. I'll show you the picture of proud flesh. So why this granulation tissue becomes excess? Because sometimes we may have the excessive vascularity. Blood flow becomes very much higher, because sometimes we may, keep moving the wound, right? So that the excessive granulation tissue formation occurs, that produces the what? Proud flesh. I'll show you the picture of the proud flesh. Another point I want to explain to you over here about the collagen, right? Collagen, we already discussed that the maximum collagen type 3 synthesis occurs at the third week. It begins as the third day, right? Third day. And tensile strength, it increases in the first week by only how much? 10% of the tensile strength will be increased during the first week, right? So that, and at this tensile strength, it becomes about 80%, right? It becomes 80% at about, the fourth month, right? Fourth month, or I think 12th week, this one. 12th week means I think third month, right? So it becomes maximum 80% about 12th week. So remember, this is also the question in the exam. 12th week, we can say 12th week means the completion of the third month and beginning of the fourth month, right? So it's similar. So this collagen, I want to tell you something over here, the off the track. This can be asked you in the exam. So in the skin, we have the maximum collagen type 1, that is about 80%, okay? And then collagen type 3 about only 20%. That's why the skin has more tensile strength. So the tensile strength maximum is given by type 1 collagen. This is one question. Another question, in the scar has about 50% type 1 collagen and then the 50% type 3 collagen. Is that okay? This is the question in the exam. And another point is that the granulation tissue, they will ask in the exam, in the granulation tissue you will have more type 3 collagen and very less type 1 collagen. Is that okay? So that the granulation tissue have very less tensile strength. I hope you understand. Is that clear? Right? So look at here. This is the granulation, angiogenesis. This is the granulation, you can see pink color, right? And this is the proud flesh. If you have the proud flesh developed, then the proud flesh should be, again excised, remove, and then again, you have to leave it for the re-healing. Is that okay? And look at here, this is the wound contraction. They have shown the 17 days. 17 days means, of course, it's a third week, right? So during the third week, about 50% of the wound contraction takes place. Is that okay? And okay, one more thing to remember over here. Wound contraction is this one. Contraction is different thing. Is that okay? That we will see in the remodeling. See, wound is contracting. The size of the wound is contracting from both the sides, right? So the wound size becomes smaller. And here we have the angiogenesis, multiple factors. Collagen type 3 is maximum during the proliferative phase. This is a question in the exam, right? So remember this one. Myofibroblast is causing the wound contraction, right? Right, so remember this one. Now let's go to the remodeling phase. Remodeling phase, we make a mnemonic as CROW, CROW. What is this one? CROW. CROW means C for, you can see the collagen cross-linking, R for collagen remodeling, right? And we can see as C for wound contraction as well. And we can say yes, W or C, we can say wound contraction, and R for what? The repigmentations. And see, CROW is black is pigmented. That's why in the remodeling phase there is the repigmentation occurs. So we use the word as CROW, 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 to remember, right? So what is the collagen cross-linking? So let's see over here in the collagen cross-linking. Collagen cross-linking means there will be the covalent bone formation between the collagen. Covalent bone formation, number one, right, in the cross-linking. Another point, collagen type 3 will be replaced by collagen type 1, right? So that the tensile strength further increases. And then the collagen, they begin to lie in the, the line, parallelly at the line of the tension. Is that okay? These things, it will occur during the collagen, the remodeling. And then the this cross linking, this cross linking, not the remodeling, sorry, cross linking, it occurs at the fourth week. Which week? At the fourth week, please remember. And then what happens over here, the collagen type 1 and collagen type 3, they becomes 4:1, as we said already. 80% of collagen type 1 and 20% of collagen type 3 in the skin, right? So that it will be replaced as 4:1 ratio. So hope you understand, right? And then we already discussed, by this the tensile strength will further increase to 80% by the 12th week. 12th week means the end of this the third month, and then the beginning of the fourth month, right? So this happens in the collagen cross-linking. After that, the collagen remodeling. What happens in the collagen remodeling? In the collagen remodeling, you will have the fibroblast. This fibroblast, they begin to release the VHL. This BHL begins to kill the HIF. So this BHF will kill the HIF. Do you remember hypoxia induced factor, which was causing the angiogenesis? So that if the HIF is killed, now new vessel formations, new vascularization will stop. If the new vascularization stops, then what happens? The old vessels, they begins to mature. If they mature, then there will be no leakage, right? No leakage of serum or fluid, so that edema will decrease. If the edema will decrease, initially when there will be new vessels, the wound looks red. Now here the wound becomes the normal skin color. Is that okay? So these things occur. So the vessels decrease, right? The number of vessels decrease, but the vessels, they matures and edema decrease, and the skin becomes normal color. At the same time, the what is this one, the fibroblasts, they also release the MMPs means matrix metalloproteinase. Matrix metalloproteinase is zinc dependent collagenase, right? This zinc dependent collagenase, they begin to destroy, right? They begin to destroy the extra collagen tissues, so that the size of the scar will decrease. Is that okay? So that at this phase, if we have the zinc deficiency, there will be the the remodeling or maturation will be delayed. Is that clear? I think you understand. And after that, we go to the wound contraction. Wound contraction continues. The fibroblast, and then we have the myofibroblast. They continue for the wound contraction. This continues up to 2 years. And we already discussed when does this wound contraction becomes maximum, this becomes maximum at 5 to 15 days, and then 50% of the wound size decrease by 4th week, that we discussed already, right? And then one more point I want to tell you over here in the collagen cross-linking. If the type 1 collagen become excessive, that produces the wound contracture. Contracture means in the joint, either the joint becomes hyperextended or hyperflexed, right? This is called wound contracture. So who produces wound contracture? That is because of the type 1 collagen excessive. And repigmentation, at the same time, we will have the keratinocytes, and then the melanocytes. Melanocytes begin to regrow, right? If they begin to regrow, then again the pigmentation occurs over the wound healed area. Is that okay? So this is about the remodeling phase. You can see this picture about the remodeling, right? Fibroblast, macrophages, matrix metalloproteinase, right? Collagenase, it is degrading the collagen, and we have the maximum collagen type 1 over here, right? And this is the same thing, whatever we discussed right now, it's written over here in the chart. If you have time and if you're interested, you can go through this one, right? So in this point, right, they can ask you some questions, right? 10% of the wound strength will be in 1 week, and then the strength keeps increasing gradually. By the 12th week, it becomes 70 to 80%, and the wound strength never reaches 100%. Remember, this is the question in the exam. And here is the healing time they have mentioned in the chart. So look at over here, the healing time. If it is the muscle, maximum it takes 1 to 6 months. If it is ligament graft repair, it takes about 12 to 24 months. If it is the tendon, it takes about 4 to 12 months. If it is bone, it takes 5 to 12 weeks, right? So you should know this one, to remove the plaster cast. and if it is the articular cartilage, it takes about 9 to 24 months, right? So remember, this is the healing time. This may not be important for exam, right? So look at here the intention of wound healing. We have different three intentions of wound healing, right? So what is the primary intention? So few points let's understand over here. If the wound is clean, we usually close the wound within 6 hours, right? This is called the primary intention of wound healing. Remember this one. Clean wound, close the wound within 6 hours of the injury. That is called what? The primary intention of wound healing, right? And usually the graft, and then you have the flap, right? These flaps and grafts are also under what? Primary intention of wound healing. And after the primary intention of wound healing, you can see the scar becomes very small, little, and it does not looks ugly, right? So it's a clean scar formation occurs, right? So this is the primary intention of the wound healing. So all kind of surgical wound, we will have what? The primary intention of wound healing. And secondary intention. What is secondary intention of wound healing? If you have the contaminated wound, right? Contaminated, or you have the infected wound, right? Infected wound, you have the dirty wound. What you do is that you will do the excision, or you will have the debridement. After this excision and debridement, if you close the wound immediately, it becomes primary intention. But if you leave the wound open for 48 hours, and if you close the wound after 48 hours within 10 days, sorry, secondary intention means you will leave the wound open, you will debride. I was telling about the tertiary intention. You will leave the wound open, you will debride, you will excise and leave the wound open to heal by itself, without closing. So this is called what? The secondary intention of wound healing. And by the secondary intention, you can see here, the bigger scar formation. It looks dirty after healing. Is that okay? So this is the secondary intention of wound healing. So all kind of the dirty wound, infected wound, traumatic wound, that goes forward the secondary intention of wound healing. Usually sometimes this surgical site infections also, we open the sutures and we leave it to heal by the secondary intention. And then what is tertiary intention of wound healing? In the tertiary intention, after this one, as this one means what? The debridement plus excision, right? We leave the wound open for 48 hours, and after 48 hours to 10 days we resuture the wound, right? So if we resuture the wound, then it forms the scar smaller than the secondary intention. So this is called what? The tertiary intention of wound healing. Sometimes this suturing we do after 10 days, right? That means 10 to 14 days. That is called the secondary suturing. Tertiary intention means we do the suturing in 48 hours to 10 days. This is also called the the delayed primary suturing. What is this called? Delayed primary suturing, or the late primary intention of wound healing. And the secondary suturing is the suturing of the wound after 10 days, 10 to 14 days. That is called secondary suturing. Is that okay? Hope you understand the delayed primary suturing and secondary suturing. Delayed primary suturing means we leave the wound open and then we do the suturing after granulation tissue formation. After granulation tissue formation, that means after 48 hours to 10 days. That is called what? The late primary suturing or delayed primary suturing. But sometimes if there is the infection persist, we have to suture the wound after 10 days, right? So this is called what? The secondary suturing. Hope you understand, right? So yes, we have some examples of primary intention, right? Secondary intentions. You see, we let it open. Here we suture, right? And here also we have the primary intention. We have secondary intention. We let the wound open in secondary intention. We close the wound less than 6 hours in primary intention, and in tertiary intention we close the wound after 48 hours to 10 days, right? So this is tertiary intention or delayed primary intention. If we suture after 10 days, we say this is secondary suturing. So we have some factors that affect the wound healing. We have some local factors and some systemic factors. Local factors, that is infection. In the tissue, if you have more than 10 to the power 5 organisms, that may be your skin flora per gram tissue, or you have a single beta hemolytic streptococcus present, right? Then this wound does not heal. heal? This is a question in the exam. What is the sign of not healing the wound, right? That means either you have the organism more than 10 to the 10 to the power 5 per gram of the tissues, or single beta hemolytic streptococcus present at the site of the wound or tissues, right? So this does not lead the tissue to heal. Why? Because they begins to eat the suture materials, suture materials. They begin to form the pus. So these are the sign of the infection. So they will not heal the wound, right? Another one is ischemia. Ischemia means if you have the less blood supply, then of course angiogenesis does not occur, nutrition does not reach, so that the wound healing will be delayed. Another point, if you have the hemoglobin less than 10 gram per deciliter, wound healing will be delayed. Is that okay? Similarly, this ischemia also produce the hypoxia, right? This hypoxia decrease the killing power of our what? Macrophages. So please remember this question. Foreign body hematoma or necrotic tissues, they are the potential site for what? Site for infection. So that there will be the problem in wound healing. They will produce the surgical site infection. But hematoma sometimes also gives the nutrition to the healing wound, nutrition, so that if the hematoma is smaller, do not drain the hematoma. Movement, if you have less movement, no blood flow, delay healing. If you have excessive movement, you have more blood flow, that produces the proud flesh. So remember, mechanical stress, you have the mechanical stress at the site of the wound. For example, you apply the tight suture, right? Tight suture means that produces what? The necrosis of the tissues, right? Similarly, the faulty technique of wound closure, yes, if the wound closure is too tight, then there will be necrosis. Loose, then there will be infections. Hypoxia we discussed already. And systemic factors we have, like the diabetes mellitus. Diabetes mellitus develop the 5Ts. 5Ts means what? It will produce the tissue hypoxia because of the atherosclerosis. Similarly, it increases the thickness of the basement membrane of the capillaries, so that the perfusion will be less. Similarly, next T means the blood become testy. Testy means increased bacterial growth, right? Bacterial growth. Similarly, another T we have, that T is what? The total failure of the defense. Total failure of the defense. That means the inflammatory cells, they becomes inactive, right? Similarly, another one is that trauma you have, because you have the neuropathy, so that will produces the multiple trauma, so that produces the delayed wound healing or the infections of the wound. Similarly, ionizing radiation, that produces the fibrosis of the tissues, so the scar becomes bigger, regeneration becomes less. Temperature, remember, 1 hour of warm ischemia, high temperature, is equal to 6 hours of cold ischemia. So please remember this one, so that if you are in the cold temperature, your wound heals faster. If you are in the higher temperature, your wound heals delayed. Is that okay? So that if you are living in the cold climates, like in the mountain region, you will live for longer, because your the tissue aging gets delayed. Is that okay? So that's the reason those people who are living in the the cold climates, they live for longer, except for some diseases, of course. Corticosteroid, if you are giving the corticosteroid, then what happens? The inflammatory phase becomes longer. If the inflammatory phase becomes longer, of course there will be the delayed wound healing. Is that okay? Because corticosteroid, they will inhibit the macrophages and then the neutrophils. But after the inflammatory phase, if you give the corticosteroid, there will be no problem. Advanced age, in the advanced phase, what happens? The fibroblast growth will be less, or collagen synthesis will be less. Malnutrition, yes, remember, if you have the malnutrition, like the what is this one, the albumin level less than 2 gram per deciliter in the blood, then wound healing does not occur. Remember this question in the exam, okay? Less than 2 gram per deciliter, right? And similarly, the vitamins and minerals we discussed already. What is this one? The copper, we discussed about the zinc, we discussed about the iron, we discussed about the vitamin C, right? So here you have to understand few points I'll tell you, right? Vitamin A deficiency occurs after 3 to 4 weeks of injury, right? Sometimes vitamin A deficiency occurs after 3 to 4 weeks of injury? This is a question in the exam. Vitamin A deficiency occurs after 3 to 4 weeks. Similarly, you will have the vitamin C, right? So vitamin C also same. Vitamin C also occurs deficiency at the 3 to 4 weeks. This is also the question in the exam. Is that okay? And zinc deficiency, you know already, zinc is involving in the remodeling phase, right? So zinc deficiency occurs during the remodeling phase, and this usually zinc deficiency occurs in the polytrauma, or you have the burn, right? So in these cases you have to give the zinc supplement to the patients. Is that okay? And similarly, you have the jaundice or uremia. If there is jaundice or uremia, then there will be inhibition of the the fibroblast growth, so that the wound contraction does not occur. And you have the malignancy or the chemotherapeutic drugs like doxorubicin. They decreases the mesenchymal cell proliferation. Similarly, they decrease the number of platelets, they decrease the inflammatory cells, they decrease the growth factors, they decrease the wound breaking strength. That's why the wound healing will be delayed. So hope you understand about the wound healing, right? So the in the next top the lecture, we will discuss about the surgical site infections, right? So this is also one of the very important topic. Then we will finish the wound. After that, we will go to the burn. Is that okay? So hope you understand. So please try go through the lecture, and then you try to make your own notes for the exam. How many points I mentioned in the exam, like the timing, the cells, right, the phases. These are very much important for your exam. Thank you very much. See you again in the next video. Thank you.